All right, I say we go ahead and get started. Hopefully a few more folks will join, but in the interest of time, I say we go right ahead. So welcome everyone to session 6 of our Medicaid Academy, Quality Assurance and Quality Improvement. Next slide. So as usual, the views, opinions, and content expressed herein do not necessarily reflect the official position of the Department of Behavioral Health and Recovery or the Healthcare Authority. Next slide. Your team today will be me, you all know me, and Terry. We have Terry again, which is very exciting. Next slide.
Oops, sorry.
We can skip over this slide.
Okay.
We can skip over this slide.
Sorry, hold on. We got, all right.
All right, so as I mentioned, today is quality assurance and quality improvement. And then this coming Thursday will be our second opportunity for Q&A. If anything is unclear on this session or any of the previous sessions, if you want help or guidance on how to use some of the suggested tools, any questions or technical assistance you're hoping for, you can join this coming Thursday and we will be here to help. Next slide.
Great.
And
right.
Terry, away.
Thank you. All right, everyone. It's good to be here again with you all. I hope your documentation session and billing session went well. I do usually do the documentation session. So throughout this, if anyone has any questions about that, I know it gets a little tricky sometimes. Once you've had some time to think about it, you can ask some questions. Hopefully at the end we have some time. So we're going to talk a little bit, just a little bit about the dimensions of quality of CSH. We're going to talk about quality improvement and understanding quality standards. We're also going to talk about outcomes and measurements and collecting data. I did the part of this session was internal monitoring and audit, which, as you remember, we did a couple of weeks ago. So I already covered that. I will be referencing it just for a little bit, but I won't be going over the auditing and the internal monitoring. So again, if you have any questions about any of that, feel free to just put them in the chat. Eva will be monitoring the chat as I'm doing the slides. So a question for all of you, and you can put it in the chat. What's the first thing that comes to mind when you hear audit or fidelity review? Accountability, compliance. What else? Documentation. Oh crap, what have we missed? That's pretty much what I think. Stress is what I think too. That they are two different things. Okay. Both have to do with accountability and monitoring, but they are very different in terms of what people are looking for. One of the things I said when I was talking about internal monitoring is that it's always best, to find your own mistakes. So you don't want an outside person coming in, finding the, oh crap, what have I missed? You want yourselves to come in and find that. So no one likes internal monitoring. No one likes that compliance piece that we do when we go into programs and do that. But again, way better for us to find our mistakes and fix them than for someone else to. Anything else anyone thinks of when you hear audit or fidelity review? Okay, so these are the two different approaches. It sometimes sounds like the quality assurance piece is the bad and the quality improvement is the good, but I would say you need both in order to have a really good quality improvement program or quality improvement plan. It's important to have both. The quality assurance piece is more of the compliance, standards, accountability. It's more of that structure. It may be focused on what the funder wants. So all of the data that you are focused on would be about what is it the funder wants, what is it that we have to report on. So it's very driven. When it says externally driven, it's very driven by what does the funder want, or what does the fidelity reviewer want, what does the state want, and that's what you focus on. And with the quality assurance piece, that is really all you focus on. It doesn't necessarily have to be sanction or finding blame or punishing, but a lot of times that's what happens, because when you do monitoring, you are looking for things that are wrong. So sometimes it might seem like it's punishing and finding blame, but really what you want to do is you want to correct. You want to have, and we talked about this at the 2 sessions ago when we talked about internal monitoring, you want to make sure that you have that process down in your policies and procedures on how you're going to fix those problems that you find in your monitoring, who does what, where it goes, who signs off on it, how do you know that the issues are fixed, and then you also want to look at what is a trend. So do 60% of our client charts not have the right intake form or not show client choice, or is it just 1 or 2 anomalies that was just a mistake? So you don't want to make this big corrective action because everyone makes mistakes. You don't want to have a big corrective action based on just a couple of mistakes. But if it's a trend, you need to look at it and you need to come up with processes around how to fix this. How did it get this way, and how do we fix it? So I would say the quality assurance piece might feel like it looks at blame, finding blame, but really what you want to do is you want to find the correction. The quality improvement, so I would say quality assurance is part of quality improvement. Quality improvement is the bigger picture based on what will move us forward, what will get us to quality on our ongoing journey to be the best that we can be, to be the best quality program we can be in terms of staff, tenants, buildings, in terms of all of that. So it's the bigger picture of how do we continue to move forward in a positive way, taking the quality assurance pieces. So you have to take that accountability and compliance. It's part of it, but also taking what is our data showing us? How do we analyze what's happening with our programs and our staff? So it's not just about compliance to funders and what the funder wants in terms of reporting, but it's a bigger picture in terms of how do we build our program to be a higher quality. So analyzing, looking at gaps, looking at strengths, looking at weaknesses, and developing a plan toward that. And it is on an ongoing journey. We're never quite there with quality improvement. We always want to be looking at something that we can do better or that we can improve upon, or a gap in our services. We're going to talk a little bit about that in a little bit. So part of the quality improvement and quality outcomes is committing to evidence-based practices. We didn't really do any services here, but I know the state does a lot of training on services. So you want to make sure that you and your staff, so if there's supervisors here and if there are directors and program managers, you want to make sure your staff have this training. Housing First, harm reduction, which is of course part of Housing First, motivational interviewing, person-centered planning is crucial with your benefit, cultural humility, and trauma-informed care. These are just suggestions. If you have training on these, doesn't mean that you don't have to have training on anything else. There's also assertive and active engagement. There's crisis de-escalation, crisis intervention, safety planning. There's a lot of training around working with our clients. And also, I always say, one training does not an expert make. So we want to make sure that we have continued training. You want to have a training plan and make sure that staff are learning. And I think we did also talk about this in the last session I did. So you want to make sure that staff are learning things and that you're helping them with their skills, whether that means role playing or talking about it in a group or talking about how they're implementing these. If we don't use our skills, we'll lose them and they'll get stale. So part of training is that skill building piece. So SAMHSA also has examples of PSH in terms of quality supportive housing. And this is when we do the fidelity review, which we will do in December, that webinar, we're going to pay more strict attention to this. This is what the state will look for in terms of these principles of supportive housing. So choice, and we know the power of choice. There's a lot of research around the power of choice with our clients and our tenants. Separation of housing and services. So you want the property management on one side, having their role and responsibilities, and services on the other. But you, as I say, as we like to say, we want to be driving in the same direction, but we want to be in our lanes, in our separate lanes. Of course, safe and affordable housing, housing integration as much as we can, making sure that our tenants are being integrated into the community. We also know how important that is when they feel part of the community that they live in. Their rights of tenancy, it's important that they understand their rights and their responsibilities of the lease and as a leaseholder. The quick access to housing, and of course the flexible voluntary services is really key and integral to Housing First. And that's also why the active engagement, motivational interviewing, and trauma-informed care is so important, that training, because it helps us with helping our clients be motivated to engage in services because it is voluntary. These are outcomes that we work with at CSH, and the outcomes, as you can see, are in the middle. We have a guide that I actually don't think we put in that shared drive, but it is in our website. And if anyone's interested, we can have you get access to it. But these are the important outcomes: tenants stay housed, the length of stay, when they leave, do they leave to a independent housing or a positive outcome, that they're satisfied with services. We're going to talk a little bit about that later. Increase their income and employment, improve their health, and they have important social and community connections. So we know that those are important outcomes when it comes to supportive housing. And these outcomes are linked and connected to keeping people successfully housed and having people have a successful housing experience. You don't want to measure outcomes if we don't believe and we don't feel that or know that they're connected to positive outcomes in being successful in housing. So these outcomes have been shown to be successful with our clients and with housing. So these you have with your benefit, the community FCS, you have pre-tenancy supports, and then you have once people are housed, so housing sustaining support. These are the services that you can bill for and that are important to have as part of your services plan and as part of your service delivery option. The functional needs assessment is where everything starts. So you want to make sure that that is present, and it's what the recommendations are to that. Remember the golden thread that I'm sure they talked about last week in terms of documentation. You want to have that golden thread. You want to make sure that the goals and recommendations from the assessment follow with the goals on the person-centered plan and the progress notes. So you want to be able, that thread should be seen throughout those documents, those documents. You want to make sure that you are connecting people. So the previous slide talked about the importance of those outcomes, and community integration and social connections is one of those. They're very important, and we know that people, our tenants, are much more successful and they feel part of the community, and just in our own lives we can see that. So we want to make sure that we're assisting people with those social services and connecting them when we're helping them find housing. We want to develop an individualized and community integration plan. So again, based on the needs from that needs assessment and part of the overall person-centered plan. The person-centered plan is your individualized plan for that specific client, not a cookie cutter plan, but based on that person's functional assessment. So you want to have short and long-term goals and measurable objectives to those goals that are reachable and that clients feel that they can actually reach. And then the supports and interventions in terms of how you're going to get to those goals. Then you have tenancy sustaining. So once someone is actually housed, these are the services also that you can provide. It's again very important that you continue that golden thread. So you're continuing those goals, to measure those goals. Someone's goals may change from pre-tenancy to tenancy. They probably will. It's okay to change those goals as long as they're still connected to what is it the client wants to achieve and what their needs are from that functional assessment. So their goals will change from finding housing, helping them access, choice, all of those, to maintaining that housing. So what do they need to do to maintain that housing? What services do they need to be connected with and linked with? What about in Social Security or employment or IDs or all of those things that we know that they need to be able to get and maintain housing? Also, anything that is able to assist them with their daily living skills, anything that will help them in the development of their living skills is services that you can provide during tenancy. Any services to help them with communicating with their landlord. It's important. A lot of times we know, many times our clients will go from 0 to 60. They won't say anything, and then they may show lots of anger and not appropriate communication. So role modeling for them, how to communicate with landlords or how to communicate with the maintenance person, how to communicate with Social Security. So all of those things you're able to bill for. All of those things are part of that tenancy sustaining services. I may say this again, but it's important that you know that cold calling landlords, maybe advocating for your program, educating landlords about the program in general, are not considered tenancy sustaining services. It needs to be connected to a specific tenant or a specific client. So if it needs to be done, landlord, we do need to have that education and outreach to landlords, absolutely. But it isn't something that is tenancy sustaining services unless it is connected to a specific client. So if anyone has any questions about that, let me know, and or any other comments. All right, I want to make sure I got everything. Yeah, one of the things I also want to say is, we are the connector, the case manager to our clients. So we're not expected to provide all things or be all things to our clients. So we're, if the client needs AA meetings, if the client needs a specific life skills group, if they need, if they're interested in attending counseling or attending groups, those are things that we should be connecting them with. And so resources and having those resources available and accessible is really important. So again, part of our job is that collaboration with community. And so it's important to have those resources available when our clients are interested. Even if client feels like they need inpatient treatment at some point, we should have those resources available. And those are all part of tenancy sustaining. So these are the outcomes that you want to track. This would probably go more on the quality assurance piece, but it's important to gather data. So you know ahead of time, you know now, these are the outcomes that you are to track. So they want to track that number of days from intake to placement in housing. How long did that take? We understand with Housing First that quick access to housing is really important. We don't want to tell someone that they're going to get housing and then have them wait for 3 months. So that quick access to housing is important. So they want to measure that. The state wants to measure that. How long are they housed? What's their tenure in the program? Have they been hospitalized? So you can see these and you can create your spreadsheet now or create your process now for collecting that data. Yeah, it is important. And we're going to show you the monthly report from, forget the name of the company, but we'll show you that monthly report, and they want you to show these outcomes in that report. So it's important that you set up your processes now and that you find a way to gather that data. And you want to make sure that you check on that. So once you set up your processes, you want to make sure you're checking on, and we're going to talk about this when we do the check, act, plan, do, check, and act. But you want to make sure that you set it up and that it's working. So you don't want to set it up and then never look at it for 6 months or 12 months. So you want to make sure it's working. Who's collecting the data? Is it what you thought it was? And that's where the quality improvement piece comes in. Maybe we thought it took 10 days to house from someone from intake to placement, but maybe in reality, maybe it took 30 days. So those are things that you want to look at. So you're not just collecting data, you're looking at the data. We're going to talk a little bit more about the self-report in terms of tenant satisfaction. Amerigroup is the name of the place I was thinking. So this is, I know it's a little hard to see, this is the tool that was developed by Amerigroup for submission monthly. It is due by the 10th of the month, and I do believe you get reminders of this. There's one for supported employment and there's one for supportive housing. And you'll see the drop-down boxes and you'll see what it is that they want you to report on. Even if you don't have any clients currently, they would still like you to submit this outcomes report and send it directly to Amerigroup. They use this report for several things, one of which is, are you accepting external referrals? And you'll see there's a drop-down box for that. So even if you don't have current clients, they would like you to complete this monthly. If you are accepting external referrals, they may send some your way. If you're not, that's important for them to know as well. So it's important that you fill this out monthly. And again, it goes directly to Amerigroup. So tenant satisfaction, we're going to talk a little bit later about feedback from tenants, but tenant satisfaction is important. And we can measure that in many, many different ways. You first and foremost, you can measure it by asking them. So surveys, and we do have some survey examples for you. So self-report of their satisfaction in housing, and you can ask them to rate it on a 1 to 5 scale. You can ask yes or no questions. You can do a mixture of both. You can ask specific focused questions about maybe activities or events or community integration, employment opportunities. So you can be really specific about their satisfaction as well, not just are you satisfied in the program. The location and safety of housing. Are people feeling safe in their housing? That's something else that you should be asking. So satisfaction, although self-report, if you ask very focused questions, you'll get a little bit more information about how the tenants are feeling. And then the percent of tenants that are satisfied with services, maybe in 1 year or more, and participation in community activities. So you may want to survey tenants maybe within the first 3 months, especially with the satisfaction of their location and safety, how they're feeling, and maybe those who have been housed for 1 year, and see what they're feeling. Questions are probably going to be different, but these surveys are really important, and you just don't want to hand out the surveys. You want to also create a process, a policy and a process for what you're going to do with the data that you collect from the surveys. We're going to talk a little bit about supported employment because this is part of the benefit. Again, the connection between employment and good health, success in programming, quality of life, self-confidence, self-efficacy has been found, and the research is there. So we understand and we know that employment is really part of a healthy outcome and success in the program. Unemployment has been linked to these poor outcomes. So on the opposite side, employment has been linked to healthier outcomes, and unemployment has been linked to these unhealthier outcomes, including not just health in terms of physical health, but also in terms of behavioral health. We know that being employed really does increase someone's self-confidence and feeling of efficacy and their ability to feel more confident and competent. And that, of course, is always important. So supported employment, similar to housing first, or similar to supportive housing, you have pre-employment services and employment services. So similar to the pre-tenancy and the tenancy sustaining, it's the same. So you want to, in this functional assessment, so the golden thread that we talked about with the housing program, you want that functional assessment, those goals, those needs. You want to see that with the service plan, and you want to see it in the documentation. It's the same way with employment. Employment is a little less rigid, so it's a little more flexible and more open to eligibility. So a little easier to find someone eligible for the supported employment services. So things that are job related, if you're helping with an assessment, if you're helping with vocational training or a class, or you're doing a inventory, you're helping them with a resume. So there's all kinds of ways that you can help someone in their job search. Similar to the landlord issue, if you are cold calling employers, educating them about your program, that would not be eligible for these pre-employment services. It has to be a specific person or a specific client helping them with their pre-employment services. And then employment sustaining. So again, similar to housing sustaining, employment sustaining. What does this person need to be able to maintain employment? We know many times that our clients are pretty good at finding jobs. They need a little bit more help and support in maintaining jobs. It's not something that they have a lot of experience in maintaining jobs. So they need some support and guidance in how to do that. So anything that you do around helping this person be sustained in their employment will be billable, or you can bill for it and implement those services. You know, of course, you want to make sure that you have proper releases all the way around, and releases of information and consent to make sure that people are okay with you. So in a job, it's a little bit different. I would imagine not all of our clients want our case manager hanging around and, like, you know, oh yeah, there's my case manager, but they may want access to you. They may want to call you if they're in a bind, or if they're upset and they need to calm down and they don't want to take it out on their coworkers or their boss. So maybe not hanging around, but also making sure that they have access to you and the ability, whatever it is that they may need to maintain that employment. I see Dawn says there's a study that shows people who are chronically unemployed die up to 25 years earlier than those of us who are typically employed. Mind-boggling, very much health related. Thank you for sharing that. That is actually incredible. Wow. If you have that, where that comes from, let us know. That's really incredible. And then supported employment follows along the 8 principles of IPS. It is fidelity. So if you want to bill for that and follow along the IPS supported employment principles, these are what they are. And the important thing is that it's very similar to Housing First. You don't have to go through vocational training or classes. You help someone get employment, competitive employment, as quickly as possible. So you want to connect them with employment as quickly as possible and wrap services around them. So if the employment, we're not waiting for someone to be compliant with their medication or any of that. If someone's interested in employment and they can work, then we help find them work quickly and wrap services around them. So it should sound very similar to supportive housing. You know, it's non-linear again, so we don't wait for someone to be employment ready, like we don't wait for someone to be housing ready, but we work with them. As you see, there's 0 exclusions. If someone is willing and able to work and agreeing to work, then that's what we do. The other piece of supported employment is that they are connected to what's interesting to them. Many times, the employment programs I've worked at many times is we found employers who are open to employing our clients when that's hard to do, it's hard to find. And then we match our clients up with those open positions. They may have had absolutely no interest in doing that. If a warehouse was accepting applications from our clients, we had clients fill out those applications and work there whether they were interested in it or not. So the supported employment goes the opposite way. They ask the clients what they're interested in, and then you find employers that have that training or skill or work that they're interested in, and then match. So it's a little bit of the opposite. And I know, just like housing, it's difficult sometimes to find employers who are willing to take a chance and employ our clients, but the client preferences is what comes first. What is interesting to them? What have they done in the past that they may want to do in the future? Or the opposite, what have they done in the past that they want to avoid? And if they have very little experience, just talking about what their skills are and interests are will help them to get a better idea of maybe where they do want to work. So those preferences are really, really important. And then benefit planning, I want to say, it's a lot of times that's the reason our clients don't want to work, is because they think they're going to lose their benefits. So you need to make sure that you're up to date on how much they can work, depending on what kind of Social Security they have or other benefits that they have, and make sure that you are educated on that and you're giving proper and accurate information about if they work, what will happen. Many times you can work and collect benefits. I don't know, I'm not an expert in that, especially in your state, but you definitely want to make sure that you are aware of that and that you give that accurate information to your clients, that they are also aware of it. Also, similar to Housing First, the support is non-time limited. Many times our clients won't want us, around, hanging around their jobs, as I said before, forever. But if the access is important, if they're having a bad day, if they don't want to, as they say, go off on someone and they want to be able to talk and de-escalate themselves, that access is really important for them. And that is also time unlimited. One other thing about the job search, the rapid job search, just like housing, when we thought people needed to be housing ready, we thought they needed to be abstinent from drugs or be in a drug and alcohol program. We thought the same with employment. We thought they should go through an 8-week vocational training class or a classroom, 8-week classroom class. And that wasn't necessarily being successful. Our clients weren't sitting through those. They got bored, they got antsy and wanted to start working. There are some, I believe there are some programs that will pay to have you go through the vocational training, and it's very short. So that could be a possibility for success. But the rapid job search is to get someone that job experience and that employment experience, not necessarily have to go through the vocational training or the class. Great. So similar to the housing outcomes, these are the employment outcomes, the supported employment outcomes. You can take a minute to read these over. They're very similar, employment related. You want to make sure you know what these outcomes are, what the state is looking for, and set up your processes and your data collection. And once again, that's the quality assurance. The quality assurance piece is, these are the requirements. We need to set up something and collect this data. The quality improvement piece of that is, what are we going to do with that data? How are we going to analyze it? Is it what we thought? And if it isn't what we thought, then is that good or bad? And what changes do we need to make? Or if it's better than we thought, what do we need to keep doing? So that's the data analysis that's really important. And fidelity to supported employment is national, and it's important that you are following that fidelity. Okay, a word about equity. We should probably spend a lot more time on it, but we wanted to at least have a few slides on equity and the importance of equity in quality improvement. So CSH has what we call the Racial Disparities and Disproportionality Index, and it shows what it does do is shows what the general population is and what the population is in all of these specific categories. So for example, chronic homeless, you'll see Black is 6.64%. and white is 0.45. So in general, to the general population, it is much higher, the Black and American Indian group, than it is with the white. The Asian and Native Hawaiian are probably underreported, but this is important to do in your area so that you are aware of the disproportionalities in your systems versus your general population. It's really important to educate yourself and have that data available and use that data to help streamline your programs and see where your gaps are in your program. This is a scenario. I'm going to read it, and then you all can take a minute to think about it, and whoever wants to respond in the chat, please do. If you have ideas. In a recent quality certification site visit, it was discovered that the experience of younger African-American men in one of the supportive housing projects was different than tenants in the building, the other tenants in the building. In a tenant focus group, when asked about program rules, I was actually part of this certification site visit. And so we did focus groups of random tenants. When asked about program rules and which rules led to eviction, it was discovered that only the younger African-American men had been written up for specific rules, like, as you can see, no slippers or tank tops in the common areas. It was a lot about dress. Other tenants weren't aware of these rules or said that they saw the signs, but regularly wore these items also without being approached by staff. So the African-American men in the focus group had received verbal or written warnings related to this rule. If we would have talked to staff, they would have not even been aware of this. So we're not saying these staff were bad people or that they were doing this on purpose. We don't think they were, but our unconscious bias and how we treat our tenants is really part of our quality improvement and should be part of our quality improvement and our outcome goals. How we treat tenants in general, and specifically our tenants of color, and making sure that staff are treating everyone with equity. So in thinking about this and thinking about your policies and procedures and your quality improvement, the values at your agency, thinking about the Medicaid benefit, what would you do to make amends to the residents? Or how would you look at your policies and procedures and make sure that this didn't happen again? And what training or supervision do you feel like your staff would need? You can certainly answer any or all of those questions, but in terms of what would you do and how would you look at this if this occurred in a tenant focus group in your agency or your program? What would you do? Great, Carolyn, thank you. Take all cultures and backgrounds into consideration. What else? Maybe some cultural humility and cultural training for your staff and supervisors could be something that you would consider. And you know, I always say that you don't want outside people to come in and find the mistakes and find issues. So here we are, an outside person coming in and doing a tenant focus group, and this comes out. So in thinking about that, even, how do you think you would be able to do that monitoring yourself without an external entity or the state coming in and finding it. Equal enforcement of rules. It could be a question that you ask the tenants in your surveys in terms of any interest, any discrimination that they feel they've gotten, any treatment that's different. That might be something that you want to ask right up front and write up. Reflect on whether the rules themselves are problematic. Thank you, Eva. Yeah. Okay, if people think of other things that they would do, just put them in the chat. I know these are tough questions. Michael says that at my previous PSH job, we reviewed all housing notice data by demographics to reveal blind spots in enforcement. Thank you for sharing that, Michael, because I think it's important. That's sometimes what the data shows us. So if you're not looking at your data by gender or race or culture, then you may be missing things. So having that data by demographics is really important. Thank you. So thanks, Michael, for that. If you're not collecting it, then you're not seeing it. Everyone should take a cultural basis class. Yes, absolutely. Thank you. So anything else, just go ahead and share. And then another question for you to consider. And I think some of you have already spoken to that, but in looking at quality improvement and your quality improvement plan and policies, what have you done? So any of you have already put training in place or collected data, as Michael mentioned, that has helped address the disparities, please share so other people can see what you've done and maybe learn from you. And if you haven't, how do you think you can use your quality improvement program to address this? And again, I'll give you all a minute to consider. Okay, well, anyone wants to share, just go ahead and do it as we move forward. Hopefully it is something you're thinking about. Maybe you just don't want to share. But anyone who has really great ideas, it's nice to share with the group so they can learn. Thanks, Eva. Set clear goals and stratify your data by demographics. Absolutely. Absolutely. Just a quick aside, the program I run, it's a statewide program for individuals leaving state prison. And for many years, we didn't collect information by gender or race or offense even. And so we started doing that and found out, and it wasn't certainly something we were doing, but we did discover that more people of color were what they call violated. So more of them had a parole violation and were reincarcerated for that, or just had a parole violation than their white counterparts. So we found out information from that. So again, if you're not collecting that data, it's important to collect it so you can look at it and analyze it. Okay, so commitment to quality is obviously ongoing. Hold on, let me look at the chat here. Would be beneficial to have so you can see where the needs are, need to be made within the program. Absolutely. Understand the history of the land where you are. Consider land acknowledgements and engage tribes in your work up front, not at the tail end. Absolutely. Thank you for sharing that, both Sherry and Jolie. Very important. All of those things are important to consider and look at. So these are the quality measures in terms of home and community-based services, which is what the Medicaid waiver is based on. The service plans have to be updated annually. We talked about that person-centered plan. It must address all those needs that start with that functional assessment. There's that golden thread again. You don't have to wait to update your service plan annually. You can do it more often, but it must be updated annually. Eligibility requirements are reviewed annually to make sure everything is still in place, all the documentation is there that's needed, they're still eligible. Providers must meet your required qualifications and training. It's important to follow that home and community-based rule, making sure that that things are the least restrictive and that clients are in the most integrated setting. The state identifies and addresses and seeks to prevent incidents of abuse, neglect, and exploitation. I think that's a requirement, a training requirement, the mandated reporter training requirement. DHS will be the ones that are responsible to review and survey the performance measurements that the CMS, the federal government, has given them, and they'll create those systems for any program improvement strategies. So these are important quality measures, again, to look at, to make sure that you are looking at them in terms of compliance and in terms of the ongoing quality improvement piece.
Just going to quickly elevate Heather's comment or question. Actually, have any organizations created discussion and problem-solving groups for program participants to give input into not only the problems, but how best to resolve? That's something we're considering in our organization and assessing how effective it could be. Interested in whether others have had success.
Great, thank you, Heather and Eva. So let's give people a chance to respond to that. I know when we, in the community where I live, which is Columbus, Ohio, Franklin County, we have had some input and involvement in new single site supportive housing buildings. And we have led tenant focus groups in other single site buildings and used their input. What would you have? What would you like to have added to this building that you're missing? Or what's really good about this building that you would want to make sure that gets inputted in this new building that's coming up? So that was we used their input for the future buildings that were being built. And we also have an advisory group in the statewide program I run. And we discuss different processes in terms of things like intake or paperwork or peers and what would help them be more successful. What have other people done? Incorporate program participants. Another thing I will say is it is important to have, when you do have some tenant run groups or discussion groups, it is important to focus on the positives and things that they would like to see and make sure that they understand where their input is going to be implemented and the importance of their input. You don't want it to just be a gripe session, but you want it to be something that is productive and beneficial for everyone. So if people want to respond to Heather, please do. Great. Okay, so just some questions. sorry, Sherry just responded, we employ former clients as well as people with lived experience of homelessness and recovery. Thank you, Sherry, for sharing that. That is important. So just some questions to consider and to ask in terms of your audit. And we're going to go through this again in the Fidelity review webinar in December and in a little bit as well. So, who's going to do what? When's it going to happen? How are you going to prepare? When do you start preparing? Are there any other standards beyond those that we listed in terms of the outcomes that you want to measure for yourself, for your program, or are there other funders that require things that weren't listed on the previous slide? So getting yourself organized in terms of, it could be a committee that you want to have around your policies and what needs to be revised, or a committee around your quality improvement program, or a committee around eligibility and collecting data that would help clients be eligible. And, so it's important to get yourself organized around all of these different things that you need to do in order to get the benefit and get the most out of this benefit for you in terms of funding and for the clients as well. We want this to be win-win all the way around. Okay. Nikki says we are having a hard time finding someone taking on new clients. Okay. That's certainly a staffing and training issue, I would think. So quickly, just to review again, we're going to review this in more detail in December, but just the steps to the Fidelity review process. You'll get your notification. You need to start preparing right away. You will review all the activities that's going to happen. The state is upfront and very clear about everything they're going to look at and what they're going to do. And then you will have that follow-up in terms of any recommendations that they have. But this is what you need to do to establish that. And again, we're going to talk much more about that in detail in December. So during the review, they will give you the letter of notification and you'll have the prep call. Again, the agency would need to start preparing right away and everything that you need to do. It does need to be a agency-wide process and involvement. It cannot be just a few people working on this. It needs to be either your program or your agency, whoever it is that's billing for this new benefit. And you need to have everyone involved, everyone educated, everyone on board, including your tenants. Staff and tenants will be interviewed and they'll do the record review as well. And they're very clear with you on how they're doing all of that and what they're doing. Then they score you and then they have the final report and recommendations. Right now, they are still incentivizing agencies for the review. I want to point out it's quite a good sum of money. And Rayanne, if you're on, I didn't write down how much it was, but it was quite a bit. So they're still incentivizing agencies to participate. They do have quite a few agencies and sites that are interested in being a reviewer, but they still need sites to review for people to volunteer, to be reviewed and be audited. And again, they're continuing to incentivize agencies who are interested in that. And yeah, Rayanne, if you want to put it in the chat, or there you go. There you go. 7,500 if it's a baseline or reviewer, and 5,000 the follow-up. Dawn Miller says. So it's not, I mean, it's
I believe
it's really important.
Did Dawn send that directly to you, Terry? If
she
you
did.
Okay, Dawn, if you wouldn't mind putting that in the chat to everyone, that would be great.
And Rayanne says email her, and Rayanne has her email right there. And really, anytime you're interested in, I mentioned all those outcomes and I mentioned all the training that you need and the best practices. Rayanne is a wealth of information and she's very helpful. I think in terms, she's been a provider, she knows what it's like in terms of state employees and people that I have met and I've worked with. She is super helpful, and I think she'll really be able to assist you in any way she can. She's all that. Okay. All right, so quality improvement and compliance. Let me get up. Okay. So it is important to have to talk about why quality improvement is important. It, you know, of course, it is important because it will help you stay compliant, and it's required in order for you to make sure that if you are reviewed, that you are in compliant with all of those requirements and outcomes. But there's many other reasons why you should embark on a quality improvement program. It really, really does improve the quality of all your programs and your staff training. You look at when you do a quality improvement, when you embark on a quality improvement plan, you look at all aspects of your program. And that's why it really helps the quality. So you're looking at the service interventions with tenants, you're looking at tenant satisfaction, you're looking at the data, you're looking at gaps in data. So what aren't we collecting? What would give us more information? You are looking at all your grants and your funding, and you're making sure that the funding is organized in such a way. So I know, I've been a provider too, I know we cobble together many different funding sources and grants. And if you've got 4 grants, you probably have 4 different requirements and 4 different outcome measures you need to measure and 4 different reports that you have to do. So having that in one place, organized, will really help you stay compliant. So again, there's that compliance piece that's really an important part of quality improvement. It will improve your outcomes. Why? Because you'll be looking at things. You'll be looking at your data. You'll be looking at the gaps in the analysis of what you're collecting and making sure you're collecting the right things. It improves your policies and procedures because again, you'll be looking at them from a compliance standpoint and from, do we have a policy to address this and are we following it? I think I mentioned when I did the policy and procedures session that I worked with agencies whose staff didn't even know where the policy and procedure manual was, how to access it. They didn't know they had guidelines around client documentation or interventions or the Medicaid rules that were necessary to have. So you definitely don't want that to be the answer when asked for your staff. So you want to be looking at your policies and procedures, making sure that you have the right ones and making sure you have the procedures that are clear, that follow the policies, and making sure your staff understand them, they know where to access them, and they're following them. And that takes follow-up, it takes asking, it takes observing, make sure that those protocols and those procedures are being followed the way that they're meant to be followed. And of course, it does keep you in compliance. I have to say, when I worked at Volunteers of America, at the time in Ohio, in order to bill Medicaid, you had to be accredited by a national body, and they don't require that anymore, but they required that then. And we chose CARP, and so it was about a 2-year-long process because we had nothing. We didn't even have a quality improvement manager, a staff person. They didn't even do anything with quality improvement. So we were starting from the beginning, and all we needed to do was continue to build. But it was a long process. But at the end, we really had a higher quality program for our clients. We had higher trained and staff, knowledgeable expertise, who were in the right positions And we just had a better all around, all of our paperwork was better and more organized. Our training programs were better. So really, we just had a more quality, higher quality program all the way around. So it's worth the investment. All right, check the chat. Great. Okay, so thank you. Dawn is saying this support employment side of the reviewer team is looking for agencies interested in participating in a baseline fidelity review. I cover the east side of Washington State, and I'm also in need of fidelity reviewers. Please let me know if you are interested. Thank you. Great. And thank you for the studies. Thank you, Dawn. Okay. So we've already talked about these. This is just a slide to show you. Here are some options for you in thinking about your quality improvement program. So we talked about the why, and we talked about the importance of it. We talked about quality assurance piece, and then the quality improvement piece. So it's really the documentation, the chart reviews, preparing for your audits, and then that continuous quality improvement. So it's the piece about the standardizations and the guidelines, the compliance, and then of course the more continuous bigger picture. Okay, some important information. Oh, thank you. Dawn found some studies around unemployment mortality. Thank you. Looks like you probably have to copy and paste that. Answer to Sherry's question. So here's a quality improvement plan. So these are, and I think you also have a handout on this in your the shared drive. This is actually actual document. So when we talk about quality improvement program, I'm talking about the program in big picture general. This is the actual plan. So just like your policies and procedures, you need a quality improvement plan that will help guide your quality improvement program. So when you are writing this plan, these are some of the sections that you can have. You don't have to have them, but these are just some sections for you to consider. I never like to reinvent the wheel if I don't have to. So we developed some of these for you to look at. And they're not necessarily in order in these boxes, but just some things to consider. So you may want to start out with actually your program and services overview. And for those, so with Volunteers of America, we had lots of programs, but we only had the one program that we were going to get CARF accredited and bill Medicaid for. But when we wrote our quality improvement plan, we decided to include all of the programs. So we had programs, just a very short description, what the goal of that program was maybe, and where it was located, because we were all over the state. So not a big thing, but a short description of the program and services in terms of, especially of the goals and outcomes. The outcome measurements and funder requirements. So you want to make sure that's part of your quality improvement plan. What each funder was requiring you to measure or to collect in each of those. Your staff training plan we've talked about. In terms of staff responsibilities, it's really, we don't want program description or position descriptions, just in terms of what it is, how it's related to your QI plan. So is our program directors responsible to make sure that the client chart reviews happen? Or is that the quality improvement person? Or are program directors responsible for making sure that the corrections are done when there's chart reviews? So the staff responsibilities are really in relation to the quality improvement plan and the monitoring that you're doing. Your policy and procedure review is more about here's the policies that need to be reviewed and the timeline. So do you have your safety policy? Do you have your incident review policy? Do you have, what policies do you need to be, that need to be approved by the board? And what's the timeline for that? Client satisfaction surveys, when do you do them? Do you only do them annually? Would you like to do them more often? Do you want to do them in the first 90 days and then annually? Do you want to do them when someone leaves? So that outlines your plan for client satisfaction surveys. And with CARF, we had to review our plan every year. So we may have changed that from year to year in terms of the client satisfaction surveys. A focus review would be more focused on a specific topic. So do you want to talk to your clients about the intake process? Do you want to talk to them about your activities on Friday night if you have a single site? So you could do a focus review that's very specific, and you could meet for 3 or 4 times to talk about this very specific thing, and then you can disband. Again, make sure that you are using that feedback in making sure that clients know how you're using that feedback, and you need to be asking for their opinions about a very specific topic for a focus review. And then all of the client charts that we talked about in the last session in terms of all the reviews that you do. Remember, billing is different than the documentation piece. For the billing piece, you want to make sure that if you build this much for this client, that you have that documentation to satisfy that, to justify that. In terms of the other, just the Medicaid compliance documentation, you want to make sure that you have all of those triggers or all of those things that are necessary in a progress note that is needed, and that the quality of the progress note is there too. So those are 2 very different focuses in terms of billing and client and Medicaid compliance. And you could also have targeted reviews. Again, I keep harping on intake, but we had some issues around intake with Volunteers of America. So we did a targeted review on how long did it take us to house someone? Did we do the proper intake information? Was the eligibility information there? So you could do it. That's what a targeted review means. You could do a targeted review on that specific thing. You could do a targeted review on staff training. You might want to take the last few people that were hired and look at the first 6 months of their hire. Did they have all the training they were supposed to do? So those are the more focused reviews you can do. So staffing and supervision considerations is important. You need to make sure that the qualifications of your staff are compliant with this new benefit. So you want to make sure that you want to look at your staff always, whenever you're reviewing anything. I didn't say this earlier, but you always want to get your baseline. Where are we now? What staff do we have in place now? What's our supervision now? What's our training plan now? And where do we want to be in order to be compliant with the benefit, or in order to be compliant with our quality improvement plan, or in order to make sure that we are compliant with all the regulations? Where do we need to be, and what is that going to take? So you always want to make sure that you're taking stock of where are we now. So looking at your staffing pattern, your teams, what does supervision look like? It's important that you make sure that you have the individual and the group supervision planned out, that you document all of that, so that you have proof or documentation that supervision is happening. You want to look at caseload size. I think Marcella probably shared with you our services budgeting tool, and the staffing, the caseload sizes that we recommend in terms of either single site or scattered site, and specific target populations, families versus transition age youth versus chronic homeless or homeless. So depending on that, your caseload size is really important. You want, I'm a licensed social worker, independent social worker. The NASW says in kind of a broad way, but the caseload sizes should be based on what your case managers can do in terms of quality work with clients, time for documentation, time for supervision, and making sure all of that happens in a quality way. That's kind of the broad, general description, but it really gives you a good idea of what you should be looking for in terms of caseload size.
Terry, I just want to highlight Sherry's question. Can we bill for supervision?
No, you cannot. As far as I know, and Rayanne may want to slip in, you cannot bill for supervision. You can, I believe you can bill collaterally if you are talking to a collateral person, landlord, employer, about a specific client, but general supervision, no. And then tenant input is here also for you just to ask yourself some questions. All right, yeah, Brian said that's correct. So when you think about billing and non-billing, you want to think about the general rule is it about a specific client for a specific goal? So, you know, if you're talking to a landlord about a specific client and the goal is to help them understand the lease or maybe their behavior is bothering neighbors or something like that, and same with employers, but just kind of general discussions, general supervision, general outreach is not. So here's some questions for you to ask yourself in terms of your tenant input. We've talked a lot about it. It's very important to this Medicaid benefit and important to the state that you incorporate the tenant voice, that you show them how you incorporate the tenant voice. You know, you can start out small and then build it up. You can pilot things. You don't have to start out right away with, you know, a big program, but you know, have it be maybe in pieces that you can work up toward having a regular advocacy or leadership group. But it's important that you get that feedback and that you be able to demonstrate how you use that feedback. And then one of the things I didn't mention about training is that it's important. It's really two kinds of training with our staff. So we've talked about the clinical pieces, orientation, having that plan, but also it's important that they have what I call the technical training, that they understand what that golden thread is, that you have someone who can read person-centered plans, read progress notes, so you can give staff some recommendations and ideas on, yes, this works, nope, this needs a little bit more. Or, you know, you said you spent an hour and 15 minutes with this client and the note says that you talked to them about their aunt visiting. And so, it wasn't anything, the time wasn't justifiable. So having someone read that and help staff with that. So that's the more technical training that they'll probably need with this. Lost my mouse. Sorry. So we talked a lot about tenant, tenant input. And I just want to say this is really about tenant input, but before we get into that, I just want to say that all stakeholder input is important. We have stakeholders, we have community stakeholders, we have collaborating stakeholders. So people that we refer to for counseling, that we refer to for behavioral health treatment, that we refer to for psychiatry, for nursing, for primary care. Those relationships are really important. And we want to make sure that we gather and incorporate their input as well. You have people that you refer to, and there's probably people that refer to you, maybe in terms of the continuum of care or those kinds. So you want to make sure that you get their feedback both ways. How is it when you refer someone to us, and when we refer someone to you, are they appropriate? Is it working out? So that stakeholder information is important as well. And then there's the community. So how are you doing with the community in terms, especially if it's a single site, in terms of community members always have a worse impression of what's going to happen before your building is built and after. So you want to make sure you gather that input as well. So getting all stakeholders' input is important. But this here is about clients and our tenants. So you want to, here's just some ways that you can get information. We've talked a lot about them already. The client rights officer is important. If your client has a grievance or needs to appeal something, it's important that they know who to go to, that is accessible to them. So again, if someone comes in and asks one of your tenants, who would you go to if you had a grievance or wanted to appeal a decision that was being made, they should know the answer to that question. You could, we talked about focus groups already, you could have a mailbox or a suggestion box. I'm not the biggest proponent of those because I think sometimes we forget about them, and then that's really the worst thing. So if you have a suggestion box or a mailbox, you need to have a process around that in terms of who's going to check it, how often it's going to get checked, who's going to get back with the people who put things in the suggestion box. You know, what's that, again, closing that loop. So you need to have those processes in place, make sure that people aren't putting things in the suggestion box and then they just never get read. Community meetings and open houses. I've worked with agencies that have done some picnics once they've been established in a neighborhood. Again, this is single site. Once they've been established in a neighborhood, to have to just open it up to communities. It's a great way to build relationships. It's a great way for community to trust the people who are living in your building, and a great way for the people in the building to trust the community. So it's a really great rapport and relationship building way to do things. And then we've already talked about satisfaction surveys. And remember that it doesn't have to be general satisfaction. It can be very specific questions about satisfaction. And as we said, incorporating safety and services and groups and activities, neighbors, all those things you can ask about. And asking about it again at different time periods. Maybe again in the first 3 months, annually, at exit. Maybe someone will be more honest with you when they're exiting than they are if they're continuing to be there. And making sure that you have that. I don't know if we have a slide on that or not, but making sure that, yeah, we do. Okay. So this is a just example, and I believe Eva put this in the shared drive. You don't have to use this specific survey, but it's just an example for you. So what do you do? So in terms of input, we want the state and you want it documented what you have done with the input. Were you able to revise any policies or procedures or house rules? You know, did something sound like a really good idea to you as staff, and then as you were implementing it, it was really in real life a terrible idea? And, you know, clients are really good at pointing that out and saying, you know, this is really a barrier for us, or it's very difficult for us to abide by this. Doesn't make any sense. So can you look at those kinds of things? Discuss it at your QI committee meeting, and making sure that you identify any action steps that you might want to take based on feedback. You also want to make sure that you let staff know and you let tenants know what you're doing with the feedback. You know, tenants, we heard you. We heard that you needed a welcome basket when you came into your new apartment. So because of that, everyone's going to get a welcome basket within the first 2 weeks, or we're doing a fundraiser to collect the things that you felt like you needed when you first moved in. So those kinds of things are really important. And with staff as well. So we don't want to ask staff for their input and their feedback and not use it either. I remember a supervisor of mine a long time ago asking me for my opinion about something. I don't even remember what it was about, but I do remember about halfway through what I was considering my important feedback to him, I realized he was not actually listening. So, and then, you know, do you think I ever gave him feedback again? So it's important with staff as well. So anytime we're asked for feedback, whether it's staff or tenants or supervisors, staff, we're asking supervisors for their feedback and their input. We want to be heard. Otherwise, if it's not negotiable and staff won't, if they won't be able to have input in it, then don't ask them. What if you don't run the housing itself and landlords are unwilling to review and revise house rules? So, I think that it's important. So if you're not the landlord, you can certainly have some conversations with landlords if they're willing. If not, then I think it's best to just work with our clients in terms of how to figure this out in the best way that they can. But you know what? Let's not always think that landlords are going to say no. Let's, help our clients come up with a good plan, help us come up with a good plan. Just like if we were going to go to a supervisor, we don't want to just ask for something with no backup, with no data, with no informed, choices to say, this is why we're asking this. So you could also do it that way as well. Okay. So call it some strategies. I probably have talked about these already. So again, we've talked about the why of quality improvement. We've talked about your quality improvement program. We've talked about your quality improvement plan, your actual document that will help guide your program and your goals. And these are some strategies that I think will help you, again, with your whole quality improvement program. Assign or designate a staff person. I say designate very carefully. If you designate a program director who already has more than a full-time job, I'm sure you will not get the result that you want. You will get the result of someone who already has a full-time job trying to fulfill this new responsibility. I know it is an investment. Hopefully, as you bill more, maybe it is something that you can invest in. We were fortunate at Volunteers of America that we were able to invest in a quality improvement manager, one person. Now there's a whole department, but and we were able to do that. Sometimes, at least to get you a start, I think I've mentioned this before, sometimes foundations can give you a capacity building grant that might help at least get you started. But know that if you give someone this responsibility who already has a full-time job, you will not get the results you want. It's important that all levels of staff are part of the process. When we were doing, I don't know if I mentioned this the last time, but when we were doing our chart reviews and doing record reviews and doing all of these things, we were so focused on gathering the information and getting started, we weren't providing the staff with summaries of reports on how they were doing. And so they told us that, and we incorporated meetings after we did each quarterly report. We met with staff to review it. How did they do? Where are they strong? Where are things looking great? What have clients said? And where were areas for development? And they were very, very appreciative of that. So you want to schedule that calendar of meetings. You want to schedule your whole calendar of chart reviews, when you're going to do them, who's going to do them, how many charts you're going to look at. So you want to schedule all of that. You want your process. I've already talked about the timeline for either reviewing policies and procedures and or approving them if they need to be approved by the board. You want that plan for communication and the plan for ongoing compliance. Closing the loop is the whole process of collecting the data, analyzing the data, and doing something with the data, which we're going to talk about here in a second. So some helpful strategies. The other issue with meetings is, and really is important, to have an agenda, start on time and end on time. We don't want anyone to dread going to meetings because they last forever. So the internal monitoring, I think we've already talked, this is just a review for all of you to make sure that when you're setting up your monitoring, you keep these things in mind. So here's the plan, do, study, and act, or it also can be called plan, do, check, and act. I've mentioned this briefly here and there, but this is a nice visual to see that closing of the loop. so that you have this as a visual for you. So the do part is where you look at your data, you're collecting data, where are the gaps, where do we think the gaps are? Doesn't have to necessarily be something you know, it could be something that you think. And so there's a lot there's in that planning phase. Sorry, I said that's the do phase, that's the planning phase. Sorry about that. That's the planning phase. You want to look at your data, you want to think about what gaps you have, what is it you want to work on, are things, do you want to collect your data by demographics and by race and gender? Have you not been doing that? Do you want to do that? Do you want to look at time from outreach to housing? You know, what is it that you want to look at that you feel would be beneficial for you as your program? So there's a lot that goes into that planning phase. And so you want to ask yourselves, what gaps do I see, or where do I want to improve? When and how am I going to get the data? So who am I going to put in charge of it? Is it a committee? Is it a person? Who's going to do that? How am I going to collect this data? What is it we want to accomplish? So what's our end goal? And then what changes can we make that will result in improvement? So there's this, that's the plan. So you want to know how you're going to do it, what you're going to collect, where you want to see it be. So what's your goal? And then what do we want to accomplish through that? Then the doing is the actual doing of that. So you start collecting the data. You start by whatever it is you're going to do. I will recommend that you check this data along the way. So if it's something you've never done before, then you might want to check it monthly or at least quarterly. Are we collecting the data that we think we're collecting? So I have this committee or these two people in charge of this. I want them to collect this data. Are they doing that? Where are they getting the data, and is it reliable? So check that along the way. And if it's something you're doing that's new, make sure that you check it earlier on than later. I've done that and it's not worked out well for me. So make sure you're checking it along the way. Then your study or the check is, okay, now we're going to measure the effectiveness. We thought that, you know, we were going to collect our information from outreach to housing. We thought it was going to be this much. We thought we were going to reach this many people. And then in reality, our data shows us this. So what is it now that our data is telling us? That's the study. We're going to analyze it. We're going to analyze the data and look for gaps or look for what's it telling us. And then the act is, what are we going to do based on that analysis of that data? Are we going to put new intake procedures into place? Are we going to put new training into place for staff? Did we find that the data that we did based on race and gender did not look as good as we expected? That evictions were a lot higher in our tenants of color than our white tenants. And if that's what that shows, what are we going to do with that data? How are we going to act upon that? So that's that closing of the loop that shows not just that we're collecting data, we're analyzing the data, and then we're acting on that analysis of the data. And then continuously doing that. And this is just a visual to remember that quality improvement is ongoing. We never end. We're always trying to get better and be better. Looking at different things. There's always something to look at and something to do. So this is just a nice visual for everybody to think about all of these aspects of continuous quality improvement. So quickly, outcomes planning. I think we've talked about this already. But these are just some, I'm going to quickly go through these because we've talked a lot about outcomes and data already, but these are just some outcomes. These are tools for you to look at, outcomes for you to look at. The state has outcomes for us to reach, as we mentioned earlier on today. They have specific outcomes in terms of, again, outreach to housing, in terms of length of housing, hospitalizations, all of those things. So each outcome measure could be its own. If you wanted to do it like this, you could have your outcome measure, how you're going to get there, what the goal is, and what is your data source. So this is a simplified plan, do, check, and act, but it's based on a specific compliance measure. So this is a measurement plan. So this is an example. You could have your successful outcome, which is, this is the measure, the percentage of tenants entering housing who either remain housed for at least 1 year within the supportive housing or who exited to other permanent housing. That's a successful housing outcome. They either stayed or they exited to another positive housing outcome, whether it's another subsidy or independent housing. The calculation is going to be the total number of tenants who remain stably housed over a 1-year period. So that definition of housing divided by the total number of tenants who are housed. So that's the calculation. Your goal is 80%. How you set your goal sometimes is based on funder requirements, but if you're not sure, I would say get a baseline. Spend, if you have the time, if you need the outcome right away, then you can look at maybe some data specific with target populations, what's out there in terms of what is considered to be a good and reasonable outcome. Or you could do a baseline. Where are we now? And where do we want to go? How do we want to improve? And then your data sources. So it could be the HMIS, your property management records, your tenant files. So that's just an example of what you can do if you wanted to use this. So that was more about the measurement, outcome measurement, and compliance with specific things, whether it's HUD or your Medicaid or your other state funding or your grants. That outcome measurement plan can help you with all of that. And then this is just another way if you wanted to look at it big picture, or if you wanted to get all of the outcomes. So we just looked at the one, successful housing. If you wanted to translate all of that into one place, again, just a tool for you. And then this is more of a quality improvement tool. So this would be, again, based on that plan, do, check, and act, or plan, do, study, and act. This would be, what's the plan? So what is it we're going to look at? Who's doing what, and the timing of it. And I would also probably add in here the data that you're collecting, but you also could put that in the plan. The check, how you're going to do it, when you're going to review it. Are you going to review it quarterly? Are you going to review it monthly? And then based on your analysis, what changes are you going to make, or how are you going to act? One place where you can put a lot of things to keep you organized. You could also do this with tenant feedback as well. Okay, we are done. That was a lot. If there's any questions, I'll give you guys 2 minutes to either respond or ask any questions, or if Fran has any, or Eva has any. Give you 2 minutes. So Thursday the 10th is a Q&A.
Yes, so this coming Thursday is Q&A. There are a couple slides after this, Terry, if you wouldn't mind.
I would love to.
Yes.
Oh, yeah, there we go.
So I definitely want to give folks the opportunity before we conclude to ask any questions. We'll stop sharing slides. We can see each other, but briefly, we have a final survey for all of you that we would love for you to complete. We want to know what was helpful. We want to know how we could make this more helpful in the future. So please scan this tag. It's also in the slide decks I emailed out last night. It will be saved, of course, in the SharePoint folder as well. And I can also send out another email with the link. If you have any trouble accessing this survey, please reach out and let me know. Thank you, Ryan. Yes, so the Q&A time is for us to talk through anything, budget, documentation, programmatic policies. Please use this time if you think it'll be helpful to your team. Also, thank you for your feedback on the survey. Yes, thank you. Thank you. We also want to give another shout out to the FCS team. They are here to answer questions. They are here to offer trainings. Rayanne, if you want to come off mute and just share some of the myriad resources that you can offer.
Yeah, absolutely. Thank you, Ava. So, we have 4 trainers, which is really unique for a state-funded program. And, we can really run the gamut of things in order to support you and your team. And so we hope that you'll utilize us for some things that might be on.
Rayanne, it sounds like you might have cut out there. We can't hear you.
I think I'll put it in the chat. My internet is shady.
Thanks, Rayanne. Sorry about that. So as you mentioned, they have 4 trainers. Apologies, I left Kimberly off. I will add her. I will update the slide deck and add her contact info as well. So please take advantage. They offer many, many different types of trainings. They're constantly creating training based on requests. I believe they have a listserv that they can email out. So if you're not on that listserv, please reach out to Rayanne. And of course, as usual, if you have questions, reach out to us. I really hope to see you all on Thursday. It will be Marcella and myself and your FCS team. Yeah, next slide. I think that might be the final slide. Yep, that is. We can go back to that there.
Yep.
Exactly. So thank you again in advance for completing the survey. Thank you to all who attended. Thank you to all who attended all 6 sessions. We know it was a lot of information. We hope it's been helpful. And with that, why don't you stop sharing your screen, and we can, if folks have questions they want to shout out, they can come off mute or share their camera. Otherwise, we can give you 15 minutes back.
So Dawn is saying she has slides with statistics from an older presentation. If anyone's interested, I think her email is on that last slide as well. Great.
All right, everyone. Well, thank you all so much. I hope you have a wonderful rest of your day. And please reach out to your FCS trainers and program managers. They are here for all of you. Have a great one, everyone.
Thanks, everybody.